Ladies and gentlemen, welcome back to the Rooted Mama podcast. Today we are joined by Jessica, a pediatric nurse practitioner and one of my closest friends. In this episode, we talk about Jess's early experiences as a nurse working in the ER and how her career continues to shape the way she lives her life today. We also had a rapid fire sequence where I basically just asked all the burning questions that every new mother has, and Jess was so gracious to answer all of them. And finally, Jess shared words of wisdom on how women who aren't mothers yet can support their friends in their transition into motherhood. Needless to say, this was a fantastic episode, and I can't wait for y'all to hear it. But before we do that, I do have two quick reminders. The first one is if you're someone who's enjoying these episodes, it would mean so much if you followed, left a review, rated it 5 stars, or shared it with someone else that you know that you think would really enjoy this content. And second, if you're looking for ways to support the podcast financially, I don't run any ads, but I do provide digital products that are easy to download and available on my website. So I'll link that in the show notes. All right, let's get into the episode. All right, Jessica, welcome to the podcast.
Thank you for having me.
Off the bat, I have to say that you are our resident medical professional in the Ireland household. So thank you for being our on-call everything.
Always around. For the
Um,
kids, I do it all.
you literally do it all, so thank you.
Of course.
So, if y'all don't know, Jessica is definitely one of my very best friends, but she's also a pediatric NP, so a pediatric nurse practitioner. And I thought that there would be a great conversation to be had for two reasons. Number one, the type of job that you have lends itself wonderfully to the Rooted Mama podcast. But then also, I think you could be really helpful to the mamas out there who have like different questions and concerns, like just things that come up in motherhood where they might not have the time to like talk to the pediatrician or like they've gotten conflicted information. And I just felt like you could help out with that. So, are you ready?
Absolutely. I'm so ready.
Okay. I think we should start with just a little bit about who you are. Like, who
Yeah.
are you? Where are you from? What do you like to do?
Yeah. So I am a very strong-willed, independent woman. I am from Connecticut, and have, you know, from a young age, I just loved everything about science, everything about medicine, and whether it was a doctor or a nurse, I knew I wanted to help people. And so that led me to nursing. And yeah, I've just always loved working with kids. I've worked with kids since as long as I can remember. I worked in daycares, camps, and now I'm a pediatric nurse practitioner. So I've been either a nurse or a nurse practitioner for the last, oh gosh, 12 years. Yeah, 12 years.
Wow.
Um, and yeah, it's just been a journey. I love helping kids. It's probably my favorite thing ever. It's definitely my calling. And yeah, that's kind of about me. Obviously, there's more to me than that.
What do you
Um,
like to do for fun?
yeah, so for fun, I'm starting to get into crocheting, which has been pretty interesting. I'm working on making my own sourdough starter.
Oh my gosh. Wait, we need to talk. Like, I didn't know this was a thing. Like, I am a
Yeah,
sourdough stan. Okay.
yes. So I did one. The first one it failed, and it's fine. I learned my lessons, and so I'm day one of the second one. We'll see how it goes.
Oh, wait. With your
Um,
starter or the bread
Yes.
itself? Okay.
No, like just trying to make a starter. My
Okay.
first starter did it failed. And
Oh my
so,
gosh. It's such a process and like you get like so committed
yes.
to this thing.
Yes, I know. I'm like, we're naming him Doug, like short for Doe, and he's gonna work this time. He'll work.
We have to say
But
a prayer for Doug.
yes. But other than that, I honestly love to bake. I'm an active service girly. That's my love language. So I'm always baking for the doctors, my colleagues at work. and feeding people, that's just what I do. So cooking's my thing. And yeah, just I recently moved into a bigger city from the suburbs. So
Mm.
just trying to embrace being a city girl again.
Hmm.
That's kind of about me.
Okay, so I have a question. Let's go back. You talked about always knowing that you wanted to be like working with kids in the medical field.
Yeah,
And I did meet you when you were an ER nurse, but I
yeah,
know that you did something before that because where we met,
yep,
you had just transplanted from Connecticut, like Northeast, and then moved
yep,
south. So
yep.
can we go back to like where you started with your nursing journey?
Yeah, so initially, I worked with adults. Unfortunately, at a time when I graduated, the market in the Northeast was so saturated and it was pretty hard for me to find a job. Eventually, after about 2 years, I was finally able to get into the pediatric world. And I actually worked with kids with cancer and different blood disorders.
Hmm.
So I did that for about 2 years and then moved down south where I worked in pediatric emergency. And honestly, I felt like I wanted to be there the rest of my life. I loved it. I loved every part of it, and I learned so much. I grew so much, and it was honestly with that that I um, kind of felt like I got to a point where I wanted more in my career and
Hmm.
decided to go back for my nurse practitioner degree. So I got my master's in 2020, and now I work with kids with heart disease. So
Wow.
mostly babies, but I do work with kind of newborns up to teenagers.
Wow. Okay. There's a lot to unpack there because I don't know if you know this, but you're like kind of a weird person to be like, yeah, I want to work with kids. Number
Yes.
one, like I want to work with kids because like I worked with kids and people around me were like, why? Right? That's number
Yep.
one. But then
Hmm.
secondly, to be working with kids who have cancer or like blood
Yep.
disorders and like in the ER. So what is it in your personality that's like, yeah,
Yeah.
let's do this. Let's do the worst possible the scariest job ever. Let's do that.
You know, it's so funny because when you're doing it, you don't think about it being so bad. You're just like, the hemonc or the oncology blood disorders, I just kind of fell into. It wasn't something I like really wanted to do, but I wanted to work with kids, and so I just kind of did it, and I ended up falling in
Mm,
love with it. And I think like the part is that unfortunately you have to see kids at their worst, but then you get to see them at their best.
mm,
No matter how long it takes. And even it's like that in the ER. There are some parents who bring their babies to the ER and it's the worst day for their kid or for their parent.
mm,
And at the end of that visit or at the end of my shift, to see smiles or to hear thank yous or to see just their baby eating and they weren't eating, but just the smallest thing, you realize the impact that you have. And that was honestly all it was for me. So, there were days where obviously the outcomes weren't the greatest and I had
mm,
terrible days, but the good days like the amount of good days fully surpassed the amount of bad days that I had as a nurse in my 10-year career, as a nurse, not as an NP. So that's honestly just what has carried me through.
So it sounds like you definitely have this ability to like not necessarily compartmentalize, but in a way
Yeah.
that's a part of it, but like
Oh, for
to
sure.
prioritize what is the outcome. Like to be able to
Yep.
put that first is important. And this is something that I talk about a lot in Rooted Mama. Like it's a part of your identity to be able
Yeah.
to um, see light in a
Yeah.
darkness, right? And it definitely is not like natural. That's why I had to like pull it out. I'm like, so let's talk about this because if
Yep.
there was someone else in the room and they're like, yeah, I want to be a nurse, I'm not sure they would immediately sign up for some of these really high stress sort of
Yeah.
jobs. And you were like,
Yep.
well, I really wanted to work with kids. So I was willing to just work with kids with rare blood disorders or like with cancer. And you were able to see the the light, over it. You're like, okay, this is what I want to do. I want to help children. I want to help families. And so this is kind of like the step that I need to take to get there. And it's definitely something that I encourage, like, when thinking about identity, right? Like when thinking about having resilience and like life endurance
Hmm.
and all of these really important skills, I think the career path that you choose really emphasizes those traits inside of yourself. Does that make sense?
No, for sure. I think just my innate interest in all things science, and just if somebody on the playground got hurt, I was like up in their business, like, what's wrong? What's bothering you? Let me see your cut. Like I wanted to know all the things. And it was like just everything about it was so interesting to me. So it was like a no-brainer for me to just go into this career. And I think like everything else, like I've obviously searched and, tried to follow my heart, but everything else, I mean, I just let my journey kind of pick what's next for me.
Mm,
Like I know that I'm meant to be in this spot, and I'm fully aware, I mean, there's a spot, and that's why I think I love nursing so much, because I feel like there's a place in it for everybody.
mm,
And you don't have to like one thing, but can fall in love with another. And the ability to be able to change and be a chameleon and find your place, find your niche, and work with it. I think that's kind of the beauty of it. Obviously, kids with cancer was not my favorite, it wasn't my favorite.
yeah.
I think I learned a lot, and it was so incredibly rewarding. It was so hard, but so rewarding. And the same thing with the ER, except that's kind of just, I think, me as a person, and then working in the ER, it was like a match made in
Mm.
heaven. And I loved everything about it.
What were some of the
Um,
things that, I mean, when I think about ER, it's like dramatic. It's like very dramatic. Like I'm not
yeah,
gonna, life in the
yeah,
ER on TLC.
yeah,
And
yeah,
so, like, what was it? I'm just curious. Like, what is life like working as a
yeah.
pediatric ER nurse?
It is chaotic. You go from I worked in a level one trauma center. So you
What does that
come
mean?
from, yeah, so a level one trauma center means that any trauma that's really bad, and that's whether it's adults or not. Obviously, I worked at a children's hospital, so for me it was just pediatrics, but a level one trauma center, whether adults or pediatric, means that the worst things you will get, because
Mm,
you have the capabilities and all of the equipment and all of the people needed to help save somebody's life.
mm,
So you're deemed this specialized center. Not every hospital is a level one trauma center.
that makes sense.
And so, there were some times where we would have kids who, were seriously injured in a car wreck. And then as soon as I'm done with that, I'm going and seeing a kid who just has a sore throat and probably had strep throat or a
Mm,
fever. And so my 12-hour shift was filled with one extreme to the other. Whether it's a kid who, you know, mom brought them in and they ended up being something seriously wrong, to a new mom who was just scared because their baby hadn't pooped in 3 days and needed help.
yeah.
So it was just, I saw from one extreme to the other and everything in between. And I think that's what kind of drew me to it. I didn't like the monotony of every single day. It was the same thing. Whereas every day I didn't know what I was walking into, and I didn't know
Mm,
how I was going to leave my shift. And it was, they say the ER attracts adrenaline junkies. And I think it's because you just always have to be on your toes because you never know what's coming through the door.
yeah.
So,
I was gonna ask, I'm like, it sounds like someone who likes that dopamine hit, like, someone who's like,
yeah.
oh, what's next?
Yeah.
What's next? And there's something to
Yeah.
be said for that too, because there are people who are like, I don't want something to come up that's like a car wreck, like it's all over the
Yeah.
place. Like someone out there might like that consistency, but I mean, that's why we're friends. I would lean more towards that too. Like I think I need novelty in my day. And
Yeah.
whatever that means, I like even seek it. It's not that I need like the rush, but it's just kind of like I will
Yeah.
get very bored doing the same thing. So that makes a lot of sense.
Yes.
But at the same
Hmm.
time, it's not, I'm talking about hobbies and stuff, and this is like your career. This is like what you have chosen to do.
Yeah.
Um,
Yeah.
and I do wonder, like, how do you, and I know you're not doing ER anymore, but it's just a thought. Like, I get into your mind and, like, how do you handle that? Like, how do you go from one
Yeah.
to another? Like, let's say that this was a very difficult, car accident or something like that. And it's, you guys got them under control, like they're stabilized, and now you have to go to your next patient. What are you doing mentally to switch over?
Mhm.
And like maybe it gets
Yeah.
easier when you've been doing it a while, but like go back to
Mhm.
when you were a younger nurse, like just starting out, like how did you learn to do that? Or was it just natural to you?
Yeah. Yeah. So initially, I think it was very hard to it honestly comes down to how well you can compartmentalize.
Yeah.
Um, Initially, that was very hard for me. You know me, I'm a girl that wears my emotions on my sleeve. If I have many faces, a poker face isn't one of them. My heart is on my sleeve at all times.
Yes.
And so it was very, very hard for me to um, shut off or switch
Mm,
characters, which I think unfortunately you do have to do because you have multiple patients, right? And each patient and each parent needs totally different things. And so you have to be able to switch your character, read the room, and like switch it up.
mm,
And there were times, unfortunately, where things I had a bad outcome with a patient, and then I have to go in because guess what? I had discharged a patient, but there's a new patient in that ER room and they need my attention. And
mm,
so you deep breath, you turn off the face, you wipe the tears, you go into the room because that patient needs you.
mm,
And so, you have to like remember that all of your patients need, if you have this much to give, every patient needs that much, and you have to figure out how you're going to give that to each patient because you can't just decide, well, I only have this much to give. That's not how it works.
yeah,
Everybody needs your best self at all times, and it takes a long time to um, learn how to compartmentalize
yeah.
and um, do that.
A lot of that, to be honest with you, as you're saying it, it sounds a lot like motherhood. Like there's things that overlap because as you're saying that, you're like, I can't, mothers have more leeway, right? Like,
Yeah,
they can be emotional, but sometimes mothers feel like they can't. They
yeah,
can't
right.
show weakness in front of their children, or they need to be strong and all of these different things. So
Yeah,
as you were saying, I mean, I didn't even expect that to come up like as a correlation, but it very much sounds like that where you have to give no matter what. There's no room for
mm,
you to just like turn off. You have to be able to
yeah,
show up for your kids and you have to be able to show up for your patients. But something else
yeah,
that stood out to me that I wanted to like take time on, because I don't know if everybody understands this about the profession. Like you said, you wipe your tears, which means as a nurse, like as a care provider, you're feeling what the patients are feeling. Like you're still a human being and you're feeling the sadness of whatever just happened. I don't know if you want to talk about that, but I think that's so important, like to
hmm yeah,
emphasize that you feel.
hmm yeah. No, for sure. Um, I have cried for so many things in my career. Not all of them were happy tears.
Hmm.
A lot of them were happy tears, but a lot of them were also um, very sad. Um, you know, whether you know, unfortunately, um, I have heard. Um, the cries of a mother, which I don't think anybody enjoys in this career.
Yeah.
It's something that I don't enjoy when I hear it. Um, but it's a feeling that although I am not a mother, it creates this visceral feeling inside of me, and
Mm,
I don't think I always said that if I become desensitized to my job, then it's time to move on.
mm,
I don't ever want to get to that point where I don't feel because I feel like if I stop feeling, then maybe I stop caring for what I'm doing. Um, and I feel like, um, you know, it's just, it's, it kind of stinks to say, but it is part of the job.
Yeah.
Um, you don't go into nursing, wishing that this happened, wishing that you have the bad days that you have. It just kind of happens and you learn how to deal with it. It's that one thing that I think nurses and healthcare providers alike bond over. um, it makes you closer as a team, as just, however your team is, where you work. But, um, it's hard. There were times where I had to step away, and it took me a long time to get my composure to be able to go back to work. And unfortunately, I've gone into rooms after that and have
Mm.
gotten yelled at by parents because I've been gone and where is my nurse? And it's hard because you can't tell them what just happened to this family, this poor family, and the awful things that just happened, and that you had to take a couple of minutes to grieve yourself. And it honestly just makes you feel guilty that this patient, took a lot of time, and here you are giving a smaller amount, like I said, to the next patient. And so it is this juggling act that you kind of, you just do.
Hmm.
You figure it out because you know what the end goal is, and your patients just your patients are what matter.
Like, is there someone who you lean on, like in those
Yeah,
moments, because you're not a silo, right? Like you don't
right.
exist in a vacuum in this
Yep,
position. So like, where's your comfort? Like not necessarily at home, but
yep,
like within
yep.
the space. Like, how do you
Hmm.
get through that? Like, who are your people? Like, what does that look like?
Yeah, in those really bad situations that you do, unfortunately have, we do have debriefing sessions. So the team as a whole will debrief about these situations, talk about what went well, what didn't go well. It's your time to kind of talk with your coworkers and, you know, try to lift them up, give each other hugs because you you um, deal with it with your group as a whole. You obviously have strong relationships, with these people that even go outside of your shift and outside of the hospital, which is wonderful, because unfortunately, you've gone through trauma together, and but you've, you know, come through it and gained really good friendships. So I think it's just having that support system, looking at your partner or your teammate to say that really sucked. Let's hug it out. Like we got this and let's finish our work. And so just kind of leaning on each other, recognizing that all the feelings that you feel are completely valid, they're completely normal, and let's get through it.
It's like you're still a human being, like even when you're trying to
Yeah.
get your job done. And
Yeah.
it brings me to this question that like you've kind of touched on already, but I've talked a lot about self-trust and like your instincts, and there's a lot of instincts in being a nurse and being a nurse practitioner. And how do you develop that skill? Is it just kind of like
Yeah.
you like live you like live and then adapt? How do you
Just
develop
come. No,
like because
literally.
it's not something that comes easily to people, right? That's what I've
Yeah.
discovered, that and even in my own
Yep.
walk in my own life, I've realized that like instincts aren't really instincts. There's not everyone is born with the same common sense, isn't so
Yeah.
common, like all of those things are true.
Yeah.
And what does that look like for you?
At the beginning, I it's funny because you go to nursing school and it's like the worst 4 years of your life, and then you come out and you're like, what did I just learn? Like I don't like and honestly, it takes you to be knocked off your feet, or it takes for you to miss something that not necessarily was like a bad thing, but just to be like, oh, like that kid did that one certain thing, and that should have been my cue that, like, oh, ears up, something, And so,
Mm.
so not to say like it takes for something bad to happen for you for it to kick in. I think that over time, with experience, you just learn to know, you know, you learn to know. You gain that instinct just, there were times where I used to triage. So I used to be up in the front and I used to be the first person to lay my eyes on kids. And there were certain times where I would be like, we're gonna go back really fast. Like, just follow me, because just I saw the kid. All I took was a 5 second head to toe of the kid, and I was like, oh no, we gotta go. Like,
Mm,
this kid needs help, and it's just something that comes with time. It's unfortunately not something that you leave your 4 year college career and just know. And
mm.
yeah, it's the same thing as nursing. But one thing I always tell this because I've met so many new moms in my career as a nurse, that mom instinct is never wrong. Like, if there's that one hint, if you have that one, well, then you're not wrong. So,
Yeah.
like, go with it. Do whatever you need to do. What's the worst thing that could happen is that nothing's wrong.
Mm,
If that's the worst thing that could happen, like, because, like, the best thing is if something really was wrong, then they're getting the help that they need, right?
right.
So if the worst thing is it could have been a false alarm, then I mean, just go with it. Your mom's instinct is never wrong. That's one thing I've always learned. Um, and it does not compare to nurse's instinct. I like to think sometimes that I've like kind of developed that a little bit, but it's just because of my career.
Years ago, when I first decided I wanted to become the best version of myself, I went out and bought this beautifully designed guided mental health journal. I was so ready to change my life, y'all. But when I got home, I looked around my apartment and every table was covered in junk. Like, I'm not kidding. Like, every table was covered in junk. So I couldn't even write on this journal, even if I wanted to. I didn't even have a clear space to sit down and write. And that moment really hit me hard because before I could grow into the person I wanted to be, I needed some simple first steps just to get my life together. That's exactly why I created the Daily Survival Planner. It's a starting place. Practical, doable strategies to help you organize your daily life so the deeper healing has room, literally room, to actually happen. You can find it in the show notes, and podcast listeners get a special discount. As you're talking, I think that your career absolutely prepares you for motherhood. I mean,
Oh yeah.
mothers are the first nurses, right? Like, in a
Yeah.
lot of ways, they're the first line of defense, and
Yeah.
there's a reason why most nurses are women, right? There's something to
Yeah.
that. Like, I think
Oh, for sure.
biologically, women are built for this. Like, we're just made for this
Yeah.
to care for
Yeah.
people, and instincts are so important. I want to get to the mothers, but before we do that, another question popped up as you were speaking. So you talked about developing that trust and instincts and just kind of
Hmm.
like being able to see a kid and be like, no, something's wrong. But what about when there's opposition? Like, maybe there's someone else who thinks they know.
Hmm.
Like, maybe
Yeah.
there's a doctor who thinks they know more, but your instincts are like the
Yeah.
alarm bells are ringing. So
Hmm.
what does it look like to advocate for your patient, when you
Yeah.
like your instincts are there, like that you're right?
Yeah. Yeah, it honestly takes practice. The good part, I think, about being in the ER is that the doctors usually very rarely doubt nurses. And so if I'm coming up to one of the attending or the head doctors and I say, you need to get to this room right now, they get up from what they're doing and they would come to the room. But that was because I had years of experience,
Mm,
and just from the experience, my instincts were high and I just, picked up on things. Um, it's it's just something that, for a majority of the time, um, there had never in my career been a doctor where if I was like, I think there's something really going on, and the doctor came to the bedside and they were like, you know, they did some. Actually, there was this one time I was so concerned. It was this newborn, and the like I don't even recall like what the baby was doing, but I was like really concerned that like something was going on with the baby. And the doctor came in, was talking to the mom, and I know like the mom was getting nervous because I think she could sense my nervousness.
Mm.
And so then she was more nervous. And so the doctor came in, and he has like three kids, right? And so he's just talking, and I loved him to death. He's just talking to the mom, doing this, but at the same time, he's looking over the baby and just, cool, calm, and collective, like not a single like ear poked up in the room. And he just goes over to, he's talking to the baby, talking to mom, and he goes and does bicycles, and the baby lets out this huge fart, and the baby was fine. Was fine. Destiny, when I tell you I was the most embarrassed nurse ever in the history of embarrassments. And I'm like, are you kidding? This kid just had to fart. This kid just had to fart. And so we left the room, and I was like, I'm an idiot. And he was like, no. He was like, did you like learn something new? I was like, I did. And he's like, all right, you're not stupid. Like it is, babies are weird. Like it's fine. We fixed it. It's fine. They're going home. Win.
That is so
you know,
funny.
but so it's like, it's things like that where, like, years down the line, if this came up, it's like, oh no, it's fine. We'll give some methadone. We'll do some bicycles. We'll, whatever. It just honestly, it comes with experience. But in those instances, like I said, doctors had, never ever been like, Jessica, that was like way off, or like, don't call me for things like that. It's always been like, if it wasn't something that was emergent, it was always a learning opportunity for me, and
Mm.
not in like a demeaning way.
Yeah.
And so I feel like I was always grateful in that sense,
Hmm. Okay, so
and
let's
lucky.
so let's move to the moms. There's probably some new
Yes.
moms out there, some pregnant mothers who are
Hmm.
listening.
Yeah.
And I've already said at the top of this episode that you're the resident medical professional. And that's because every once in a while I will call you panicked about something, or like FaceTime
Yeah.
you in the middle of the day, like, what's wrong with my baby?
Yes.
And so, you're used to this. And I wonder, like, okay, how do I phrase this? Like, what would you say are your top, like, things to look out for a pregnant mother, or specifically like in those early days? Because I feel like moms start to figure
Yeah.
it out, but like, what are
Mhm.
things that we should be looking out for that maybe like get overlooked, or like, I don't know, I'll leave the door open. And like, what do
Yeah.
you see most often?
Yeah. So probably one of the things that I saw most one of the things that I saw most often was like neonatal fever. Um and so I always tell parents, within that first, if your baby is between 0 days, or from the time they get home from the hospital, or if they're still in the hospital, up until 28 days of life, if they have a fever, it's not something that you go to your doctor for. It's something you go to the ER for.
Hmm.
um
Why,
and
like,
that's
why is
just,
that?
yeah. So, it because of their susceptibility to bacteria. Also, they still have, it could be an infection that was transmitted from mom. All of these things, unfortunately, if it gets into the bloodstream and then up into the brain, it can cause a bad infection.
Hmm.
And so babies would need antibiotics for that. So any fever kind of within the first 28 days, I would always go to the ER for. It could be as simple as you had, a baby at home that was also sick.
Hmm.
And that could be as simple as it is. It could be a urinary tract infection. No big deal. We can treat that. It could be something more serious. So always within that first 28 days of life, if your baby's temperature is 100.4 or higher, you want to go to the ER just to make sure that everything is okay with your baby.
What's the best way to measure their temperature?
So, best way to measure temperature in a baby is going to be in the bottom. Um, it's the most core temperature. If you just have, if you don't want to do the bottom, just because that makes you a little bit apprehensive, you can do under the arm. But any temperature, especially in a newborn, to the ear or to the forehead, isn't very accurate. So I would try
Hmm.
to stick to a more central temperature, so underarm, or up the bottom.
Okay. See, I'm asking that because, like, I think I had the wrong thermometer. So even there's something to that because the thermometer took like 10 seconds to go and then you like put it in their bottom, you're like holding it for 10 seconds. Like so can
Yes.
you talk about thermometers? Like what are we looking for
Yeah.
there?
Yeah. So, if you put a thermometer in the bottom, you shouldn't have to put it in more than 1 inch. It really should just, just the first initial tip, maybe like a centimeter, a little bit more should be going into their bottom. And usually what I do if you're changing a diaper, that's like the perfect time to do
Mm.
it. Just kind of lift their legs up like as if you were wiping their bottom. And I always just tell parents, you can like, parents always get worried. They're like, well, what if they're going to move and it's going to
Yes.
stab something? So, so what I tell them is with one hand, you put the thermometer and the other hand, you pinch their cheeks and just kind of hold it there.
Ah.
Um, and if you do the underarm, one arm, obviously you're going to put it under, and then one arm you can just hold on top to make it nice and um, tight, a closed space, so that way you get an accurate
Hmm.
temperature.
Does it have to be
Um,
those long like
yeah.
temperature readings or could it be like a
So
quick like 3 second? Because there's different
it kind
settings.
Yeah, it really all depends on the thermometer. Usually the rectal thermometers, they can look like an oral thermometer. That's typically what so one of those regular oral thermometers where you hit the button and you look and it'll either beep or it'll show an L or a C
Mm.
or something to say that it's ready. And then you put it, and then it kind of like does a little dial. So unfortunately, you do have to wait for the dial to kind of be completed for it to give you a temperature. Or if you see the number going up, you have to wait till it beeps to get the final temperature.
Hmm.
So some of them, yes, are a little bit faster than others. It just kind of depends on the thermometer that you have.
Okay. Now for a baby, like I'm thinking about for fever still. They
Yeah.
might have a temperature, but would there be other
Hmm.
signs that kind of go with
Yeah.
it to be looking for like what the way that
Yeah.
they're acting? Or could it literally just be like they look normal but they have a temperature? Like do they usually
Yeah.
go hand in hand?
Yeah. Yeah, so some babies, I have seen babies look overall okay and just have a fever. They might be breathing really fast because babies, when they have fever, their heart rate will go up
Mm.
and also they'll breathe faster. So you might see that they might be panting or just breathing very fast. Some babies might look a little bit pale. Some babies, if they're not eating and they're just irritable, those are signs of concerns. So it kind of depends. Some babies, yes, I'm sure you've seen with your babes, sometimes they have this fever and you're like, how are you bouncing off the wall?
Yes.
Whereas other times they have this fever and they're like laid up in the bed. You can't even get them to take a sip of water.
Right.
So, that's kind of another topic for obviously older kids. But for babies, usually sometimes are either irritable or not really eating as well. Um, those might be some of the symptoms that you might see.
I know one of the things that I would always be kind of confused about is that when they say they're like lethargic or tired, I'm like, okay, this is a newborn. So I'm just trying to like make sense of what a
Yeah,
tired newborn looks
yeah,
like a lethargic newborn.
right. Yeah. So, lethargic is a word in the ER that we all hate.
Okay.
And the reason being is because the way in the ER and even just in medicine in general, you're taught the word lethargic means like you're like I'm tapping you or I'm trying to arouse you and you're like barely waking up.
Mm.
And so, kids who, if a parent's complaint is, oh, my baby has a fever and they're lethargic, right? Now, if a baby has a fever, or if any kiddo has a fever and they just, think about yourself. You're just laying on the couch. You don't want to move. You just want to sleep.
Hmm.
That's more like sleepy or feeling the symptoms of what a fever can bring, right? So it's not necessarily lethargic. um, Babies, we all know that they appropriately eat, sleep, poop. Those are the only three things that they're responsible for. Those are their only jobs until they get older. And so, obviously, if you have a newborn or a 1 or 2 month old and they're sleeping 6, 7 hours, which you don't
Mm,
really want them to. You want them to be feeding more regularly every 3 to 4 hours. People will say, let those sleeping babies lie. Like, no, not at that age. At that
okay.
age, you need to wake your baby up and you need to have your baby feed. What I always tell parents, especially for newborns, I've had parents come in where they're like, I can't get my baby to wake up to feed. I always tell them, I'm like, put them on your changing table and unwrap them, make them naked.
Yeah.
That'll wake them up because babies don't like to be cold. They
Yeah.
like to be nice and snuggled and warm. So you change their diaper, you take off their clothes, change their clothes, make them cold, and I assure you they will wake up.
And if they
If they don't wake
don't,
up,
they're lethargic.
then that's correct.
Okay,
Correct.
this is so
Yeah.
helpful. Thank you. This is super helpful.
Yes.
Okay, I have another one. This is like just firing,
Yeah.
okay? Another, well, because I'm thinking about those first few, especially with my older child, those first few months and things just like coming up one thing after another. But
Yep.
even like within the first couple of days, something else that I noticed was like weird breathing. Like they breathe super
Yes.
weird. And I'm like, are you dying? Are you dying?
Yes.
So could you talk about newborn breaths?
Yeah. Yeah. So, babies breathe so weird.
So weird.
We call it transient. Their breathing is transient, right? Or it varies.
Okay.
One thing that we have is transient tachypnea of the newborn. All that means is intermittent, really fast breathing of the newborn.
Okay.
And so sometimes what you'll see newborns do is they'll go,
Yes.
right?
And freak
And
their mothers
so,
out.
yes. Now, really long pauses we don't like are apnea.
Okay.
Pauses of no breathing we don't like. But those are pretty long pauses. Most babies, if they're having those type of periods of not breathing that are very long, chances are they're in the NICU and they're probably a premature baby.
Okay.
Usually normal babies don't do that for no reason. Um, but you can have pauses in the breathing that might seem like it's forever. We always, if there's a pause, it usually shouldn't be greater than like 20 seconds. That's not to say, count your baby's breathing. If they look good and they're just kind of have a short little pause, always like poke them a little bit and have make them breathe, but usually babies are okay. But yes, it can be scary, especially as a new mom. Some babies actually breathe very noisy and it could be normal as well. Babies make a lot of noises and they can be, I think that's something that nobody talks about,
Yeah.
that babies are so incredibly noisy and just make weird noises all the time, and a lot of it's normal. They're just babies and
Okay.
make a lot of noise.
I mean, it's so true. And this is like super helpful conversation. And
Yeah,
I was thinking about going along with breathing.
yeah,
When would be, what are we looking at for a baby who is struggling to breathe? Like, I've seen things about looking at their chest. Like, if you know your
yeah,
baby, um, we've gotten past like something's wrong. Like, mother instinct is
yeah,
coming in, something's wrong. Like,
yeah.
what does something wrong look like, especially with breathing?
Yeah, so if we're talking about the newborn period or even the
Like
infant
older,
period, a lot of
yeah.
babies, right, you'll see that they just use their belly to breathe. Their belly will go up and down when they breathe, which is normal. However, if you start to see visible signs that a baby is working to breathe, so they're having nasal flaring or their nose is their nostrils are flaring when they breathe. Some babies, you'll see them sink in um, right here at the top of their sternum or breastbone,
Hmm.
or you might see sinking at their ribs or underneath their rib cage. And, I always explain if it looks like they're kind of sucking in at their ribs and like they're really working to breathe, then that would be something of concern. There's something going on that's making them work to breathe.
Okay.
Um, I've had some babies come in and all it is they have huge boogers in their nose that just need to be suctioned out. or they've had a respiratory illness or pneumonia,
Mm,
so it can kind of vary what's going on. But I would say, if they're breathing like that, better safe to get them checked out.
okay. All right, so let's go on to like older babies because I'm thinking about, and I asked you this question like a while ago, and I'm still seeing these products recommended, and I just wanted to get your
Mhm.
input. So, for choking, for babies who are
Yeah.
choking, like this is something that's a personal fear of mine. Like when I was a child, I choked on sausage, like the skin of a
Oh,
sausage, and I like
yes.
my aunt had to do the Heimlich on
The
me. Yeah.
Heimlich. Oh my
Yeah,
goodness.
like legitimately. So like this is like a thing. I cut everybody. Like I will cut my husband's food if I have to. Like I'm so nervous about this. Like it's a
Yes.
thing for me. And I think also like
Yes.
as a speech therapist too, like understanding people aspirating and like what that entails. And so
Yes.
I see these choking apparatuses all the time. Like you put a mask.
Yes.
Can you talk about
Yes.
like what is good to do for a child that, has a baby that swallowed something or a child? Like what do you do? What's the best practice?
Yep. Yeah. So, if you're talking about BLS or first aid, basic life support, BLS, obviously depends on the age for kids. And kind of before I say this, I recommend to all parents, you should definitely, if you're a new parent or, a parent to be, take a BLS course. Spend the money, invest in it, take the BLS course. If not for yourself or your child, but for a family, you know, take the course. But if you don't have equipment, what you'll do is now the practice is 5 back blows, followed by 5 um, abdominal thrusts. Now there are those apparatuses. I personally have never worked with them myself. We didn't have them in the ER, but I have seen videos on them working, and they appear to be really good tools.
Mm.
Pretty much what it does is it acts like a suction cup, and so it goes over the mouth, I think.
Yeah.
I think it
Yeah, it
goes
goes
over
over
the
the
mouth,
mouth. Yeah.
and you kind of use suction and pull, and it's meant to act like a suction to get the whatever it is out of the airway.
Mhm.
It seems that they help. Unfortunately, it's kind of the same thing as basic life support, right? Like there's obviously probably some user error if you've never used it before, if you haven't watched videos or practiced using it. Same thing with, CPR and basic life support. If you haven't practiced or taken the course and you're in that kind of moment of something going wrong, you might not know what to do.
Mhm.
But I would say if you don't have that equipment or aren't familiar with it, the 5 back blows and 5 abdominal thrusts. Um, and I would say if, after a time or two, if you see color changing your baby or child, um, or feel like you're not helping, it doesn't hurt to just call 911.
Yeah. Right. And those moments it's like every second counts, right?
Mm-hmm.
Yeah.
Yes.
I was thinking about this one other tool, and then we'll go on to the
Yeah.
next question because I see it a lot. And I want to know, is it actually helpful? Those socks on babies, like those things that they put on their
The
baby,
owlet.
owlet. Yes. Is this
Yeah.
helpful? Does the new mom
Yeah.
need to spend the money on this? What do you have to say about it?
So, it has become very popular. Um, I think to each his own. I think sometimes, and I say this, so as obviously a healthcare provider, I've had nurses who become moms who tell me sometimes it's terrible that you know too much.
Mm,
And so, kind of the same thing. I feel like if you have that and your baby doesn't have a need for it, it might cause you to kind of hyperfixate on it. Um, it isn't, there is data out there that shows that it's a great tool, but even tools like we have in the hospital for the same thing, there's user error and there's things called artifact, right? So obviously if a baby is moving around in the hospital and their oxygen on the monitor is telling me it's very, very low, but I can see that they're just moving. I know it's not a correct oxygen number.
That makes sense.
It's the same thing with the owlet, right? If you have a baby that's wiggly, wiggly, and which all babies are wiggly and move a lot, it might give you false readings and it might make, I just don't want, I always tell parents, it might cause added stress. It might cause you to hyperfixate on this thing or panic if you see something um, that, might not be alarming, but you might not know that.
Right.
And so, to each his own. But I hear it's a great tool. I know some of our parents have used it for their babies with heart disease, or have gotten it. For subsequent kids just because of their kid with heart disease, whether their other kids didn't have heart disease.
Mm.
So yeah, um, I'm not against them. I'm not for them,
You're just
but it's it is a tool that can help
okay.
um,
That's helpful.
if it's something that you feel like your baby needs.
Yeah. And we never even talked about the current position that you're in, like working with kids
Yes.
with heart disease. I okay, so here's a question. With these babies, is it m- more likely that a baby will you'll know that a baby has a heart condition before they're born, or like what are you seeing? Do you see you like they know already like through the ultrasounds and stuff, or are there
Hmm.
babies who are born and it's just like a fluke, like you just find out when they're alive that they have a heart
Yeah.
condition? How does that usually work?
Yeah, so when all mothers are pregnant, I believe it's at 20 weeks, they all have an anatomy scan. And with this anatomy scan, if there's anything on those images that flag, um, whether it's a problem with the baby's limbs or the brain or the heart, if they see anything abnormal, they're automatically going to send you for further testing. And so a lot of the mothers and fathers that I deal with, they know that their baby has a heart disease, has a heart condition or a heart defect prior to the baby being born, especially if it is a very serious and can be, if it's a heart lesion or a defect that can be fatal. They
Mm.
absolutely have been counseled on this. And so we try to counsel them, or I don't, but the doctors and even some of the cardiac surgeons will meet with these families and discuss, different variations of kind of what can happen because yes, you diagnose this condition, but there could be change. Once the baby's born, the heart could look a little bit different
Hmm.
just because circulation in your belly is different from when the baby is born.
That was
Um,
actually a
there,
big question of mine because
yeah,
if a baby has a heart defect while they're in utero, like how are they
yep,
staying alive? Like how are
yeah,
they still going, I guess? Could you answer that?
yeah.
Is that something
Yeah, yeah. So, actually, a big, so there are vessels that are open within the baby that are there in fetal circulation or in utero that help the baby get blood to where it needs to go because when the baby is inside mom, they're not using their lungs. Their lungs are actually filled with blood.
Mm.
And so there's different circulations to get blood from mom through the placenta to the baby, back to the placenta, back to mom. And so there are fetal circulations that are present, but some of those circulations change once a baby is born or stop.
Mm.
Some of them stop. Now, because a baby was fine in your belly, um, doesn't necessarily mean they'll be fine after they're born. And so there are certain medications that we can give to help them kind of maintain some of that fetal circulation. So that way, their heart still functions as it should and they're getting appropriate blood to their lungs or their body until
Wow.
we can fix their heart.
Wow. That's amazing.
It's pretty
Yeah,
cool.
that is like you just said you'd like
Yeah.
maintain a part of their mother essentially outside of the womb. So that's like super cool. Um okay, so the baby is born and you know that they have a major heart defect. You talked about the surgery. Like how soon can doctors
Mhm.
do surgery on newborn
Yeah.
babies.
Yeah, it kind of all depends on the heart defect. There are some babies who have surgery within their first week of life.
Wow.
And there are some babies that can sometimes have different procedures to help get them to grow a little bit and be a little bit older before they get a big surgery. Some kids can go home and come back for their surgery. It really just depends on the type of heart defect that they have. But we do have quite a bit of babies who will have a baby, oh, I'm sorry, will have a surgery within their first week or so of life,
Wow.
week or two.
I just envision like this tiny little person like on a
Yeah, yeah,
surgical table. Like how did they even
yeah, yeah,
this is
it is. It
for the
it
podcast
blows
listeners,
my
I'm
mind.
making like tiny
Yeah.
hand movements because I'm just thinking about how tiny they are.
You know, it blows my mind. I that was one of the things when I first started. I was like, I need to go watch a surgery because like I want to see like what these doctors are doing. And it's crazy because we have three surgeons, they're all men, right? Big hands, they're
Yeah.
men. And a baby's heart can be the size of a
Oh
walnut,
my gosh.
right? And
Yes.
like it blows my mind. Like I'm seeing on the screen these structures that are so small and like their hands are just so delicate and like helping. It's ridiculously crazy,
Yeah.
but you know, they're helping these babies, so
Yeah. Wow.
it's just crazy. It's crazy.
Yeah. I
Yeah.
have a lot of so much respect, and then also just like thank God that there are people who are trained enough to do this because
Oh yeah.
oh my gosh, it's literally life or death. And I know like so many, I've lost a child, early on, but like I know so many mothers who have lost their babies, and like before a certain time this didn't exist, and like these babies
Yeah.
would just have to be lost, and like I know what that feels like, so it's amazing to have this technology and like the skill to do that. But okay, so we've been talking a long time, and I feel like I could ask a million questions. I think I'm gonna have to like get your tag and be like, write down questions for
Yes.
for part two
Right.
but anyway, I do have one final question, and this is something that
Yeah.
is it's actually personal. It's something that I noticed about you that is not common, and I wanted to get your input. So, you as a woman who you don't have kids yet, you're not a mom, right?
Right.
But you are a friend and you are an aunt and you have like all of these different roles. Something that mothers complain about a lot is that when they become a mom, they lose their friends. Where are their friends?
Hmm.
What happened? Like they had this, this group of people, and then because they weren't mothers, now they're not there. And I find that
Hmm.
this is not you. You are not that person. You're not that
Hmm.
friend who disappears when a friend becomes a mother. In fact, it's like the opposite. Like you very much walk with your friends through whoever they are, whatever they're doing. And I
Hmm.
wanted to know like what is it in you that makes it
Hmm.
so? And then what is your what is your kind of advice to women who aren't mothers yet, who do have friends who are
Hmm.
mothers? Like, what could
Yeah.
you say to them, like to continue to, support their friends and be there for them?
You know, it honestly just boils down to love for the mother. And because I love them so much, I just love their baby so much. It took a long time, and my career, I think, helped me quite a bit, where I just had this shift. And maybe it was like me also like gaining emotional maturity and just becoming of that age of a woman, typically being of of being childbearing age,
Hmm.
where I just kind of realized that mothers like don't like a baby is born and nobody cares about the mother. And I know we've had so many talks about this, especially, with your pregnancy with your second baby. And, I just, I learned that, like, yes, this baby's born, but like, you don't need me to help you with your baby. You're the only person that can help your baby. You're the only person that can feed your baby. Like, you are sustaining life for your baby. And so, I can only be of assistance to you. And I feel like as your baby grows, my assistance to you as a friend and just as a person who cares about you is going to change as your baby gets older. And, one of my best friends just had a baby. And at the beginning, it was, cooking for her. It was, helping fold the other kiddos' clothes or like, kind of doing random things around the house or, holding the baby, feeding him a bottle, holding him so that she could go take a shower kind of
Mm,
thing. Um, and now obviously it's shifted as the baby becomes more mobile and, mom is more available to do other things. And, it was even, I'm there to help with the other kids because that kid, when you have two other toddlers and a newborn, that can be a lot and overstimulating and chaotic. And so
yes.
I've just kind of, I feel like I've tried my best in with the women in my life who have had babies who are very important, to me. I've just tried to go through it with them and kind of support them as they can because I think mothers for sure are so under cared for
Mm,
right after they give birth to a baby. And I think if there's one thing that I can say to the mothers or mothers to be or people or mothers wanting to become mothers in the future is that your support, they're always going to people who are going to say, "Oh, let me hold your baby," or, have that power. If one of your friends is saying, "Oh, can I come over and see the baby?" Say like, "Yeah, you can come over. I really," tell them you really need help with something. Sometimes people don't know how to give you help. And it's also hard for you as a mother to ask for help.
mm,
And so it's really important just to create, have your circle, have your people that you know that you can count on, but also do not be afraid to ask for help. It is a very hard time for you, hormone wise, just physically, mentally, emotionally, it's just a lot, and you need support too.
mm.
Because, you can only support yourself so much. You have this baby that needs all of you. And so somebody, you can't pour into yourself when you're trying to pour it into a baby. So find those people that can fill your cup.
Yeah. I think you bring up two important points that number one, the friendship in the beginning before the child even existed needs to be of value, right? So sometimes
Oh,
the
for sure.
friends that disappear were never really good friends to begin with. So it's not necessarily
Right.
that like all friends go away when you become a mom. It's that the type of friends that
Mhm.
you had were never actually that great of friends to begin with. And so they don't like follow through and into motherhood. But then the other thing is like you as someone on the outside, you bring up a good point that mothers don't ask for help, right? Like maybe you
Mhm.
have friends who do want to help. They just don't know what to do. Now, especially if they're not a
Right.
mom, maybe they don't know what to do. You have the
Correct.
wonderful background of being a nurse for peds,
Yep.
which means you were a nurse to mothers, right? So like you do kind of
Right.
had that leg up and like seeing what that experience is like, but not like maybe you have a friend who's in sales who's never experienced anything to do with childhood or motherhood or anything,
Yep.
right? And so maybe you have a really good friend who knows nothing about this but wants to help and they just don't know how. And you
Yep.
haven't asked or you haven't told them. And I do know from the other side that you're right. We're exhausted. Sometimes we don't even know what we want. But if you're
Exactly.
in the position where you're listening to the Rooted Mama podcast and you're not a mother yet, or maybe you're pregnant with your second or whatever, that would be my advice to think about this beforehand. Like, think about the ways, like Jess, you talked about your love language. Your love language is acts
Hmm.
of service. So that would be my one of my recommendations to like find some of that stuff out now. Like start to know yourself. That way you can ask for help because you know what you need. Like if you're an acts of service person and then you want your friends to come and help you, then you're probably going to want them to do service things. But if you're more of like a
Right.
words of affirmation kind of girl, maybe you want your friends to come and tell you how you still look, girl, you look good. Like that baby didn't do
Right.
nothing. You know what I mean? Like maybe that's what you need.
Right.
But if you don't know who you are, like you don't know what you need, then how can you tell someone else? And like, how can you expect that of them? Right? You can't expect
Right.
them to know. So
Hmm.
I'm thankful that you brought that up. Like you want to help.
Hmm.
A lot of friends want to help. They don't
Yep.
know where to start. Sometimes they don't know where
Yep.
to start, and they can't read
Right.
your mind, you know?
Right.
Just like
And
your
it could be
partner
as
can't
simple
read your
as
mind either, right? So,
100%. And it could honestly be as simple as if you and your partner, right, you've decided that you are going to have a baby, you conceive, you're pregnant, right? You obviously, the whole 10 months that you're pregnant, you are discussing and planning with your partner on how is this going to work. You're going to identify the things that you need from your partner um
that's the
before
hope
this baby
anyway.
even right, that's the hope anyway, right? There's hopefully some conversations in there, but if if you have that friend who clearly you have that friend who you clearly have that relationship with, where you start having those conversations and asking questions. I think that's your point, to be like, okay, I think I can count on this person. Like maybe I should come up with a plan. Like they clearly want to help. Like maybe they can be of assistance some kind of
Mm.
way. And that's kind of what happened with my friend who just had her baby. Like I had planned on, I'm going to come, after delivery, and this is what I'm going to help with. And then, after you go home, this is, you can count on me once or twice a week, and this is what I'll do. And tell me, I'll tell you a week in advance the days that I'm coming. So if you need
Mm.
tasks for me to do, if you need me to pick up groceries, if you need, that I'm coming these days, and like, what can I do? Just think about two, maybe one or two things in your chaotic life of what I can help you with those days. So then I'm prepared to get there and like get the ball rolling and help you. So sometimes it's just as finding that person that clearly has interest in you being pregnant and wanting to be in your life,
Mm.
to start having those conversations on how they can help you.
Yeah.
Um, yeah.
That's super helpful, and it's something that people definitely aren't thinking about, but it's such a good bit of advice. Okay, Jess, this has been
Yes,
fantastic. Thank
I'm
you so
so
much. Like I didn't know exactly where this was gonna go, but it's just like
yeah.
exactly what God designed, because we touched on so many
Yes.
things, and I know that this episode is gonna help so many women before motherhood and the women who are already like deep in the trenches.
Yes, I'm so glad that I could help. I'm glad. I think we touched a lot of things, and um yeah, it was a great time. Anything for you and anything for the mamas.
So we're gonna have to do. I think we're gonna do like Ask Nurse Jess. Like we're gonna have an episode where I
Yeah.
do like a poll, and then
Yeah,
we send
do
like
it.
listener questions, because I know
Questions, do it. Do it.
there's so many questions that I like just pop into my head as a even as a second
Yes.
time mom. Sometimes it's just kind of like you think you know what you're doing, but then you don't, and you got to call a
Yes.
friend, phone a friend.
No, right. No, I'm down. Let's totally do like a Q and A session. Everybody
Yes,
get your questions, write them down, add them to the chat box,
yes,
and we'll have another episode.
amazing.